Well, welcome everybody. This is our May edition of Lunch with a Doc, and I am so glad that those that are present live are here with us. And I know that there will be many people catching this on the rewind. And so at first, I just want to introduce myself. I am Cindy Trow, and I am a transformational health coach. I help people create health from the inside out and outside in so they could live a life of freedom and confidence. And I am honored to be joined here today with several other health professionals that are going to shine the light on mental health awareness. We are going to each share our viewpoint and the facts and some warning signs and lifestyle habits that we can put all together to support those around us that are suffering from any form of mental illness. I encourage you to think of your questions. If you have anything to contribute, we would like that as well. And we will have a question session, towards the end of our time together today. So we're going to really try to respect each other's time. So I'm going to go ahead and get started with the introductions. We have Dr. Brian Sanders. Dr. Brian Sanders is a board certified family medicine physician. He has a direct primary care practice in the Smyrna area. And what that means, direct primary care, means that you as a patient and he as a doctor are the only ones that come together and make decisions about your health and take the insurance company out of it so that you get the best care for yourself. And he has the time and the resources to serve you in the way that every patient wants to be served. And very much like Dr. Brian Sanders is Dr. Rocco Romeo. He too partners with Dr. Brian Sanders, and he has the Here to Help Urgent Care Center here in Roswell, Georgia. And so we all need doctors, and we're not always around doctors. After 5, they're closed, and that is wonderful to know that we have resources available to us as well. And today we are delighted. We have our guest presenter today is Melissa Cammack, and she is a licensed professional counselor who will be sharing with us warning signs that we could look for to support people in our world. So let's go ahead and get started. And Dr. Romeo, do you want to lead us in sharing what we've got?
Thank you as always for a wonderful introduction, Cindy, and thank you for all for being here. So I'm going to let Melissa kind of get more to the meat of it, but I wanted to start off with just some statistics and kind of like what Dr. Sanders and I do in our small part when it comes to mental health. And I say small, Dr. Sanders actually plays a large part because we all know primary care is where the bulk of mental health seems to fall these days. So I appreciate everything you do for the people out there in need. So let's not skirt around it. Let's talk about COVID again. In the first year of COVID pandemic, global prevalence of anxiety and depression increased by a massive 25%. I mean, let that sink in. 25% increase. One major explanation in the increase of unprecedented stress was caused by social isolation. I mean, this is something that not every one of us experienced. And if you remember the Tom Hanks film where he decided to befriend a volleyball named Wilson, you can see that we had a good grasp of how isolation would affect us because we've seen it in the past, but to a massive degree, it seemed like it had such a significant cultural impact, but all the way down to the individual level for a significant number of people. Now, on top of loneliness, think of fear of infection. Everyone knows every day you walk out, there's something that could happen, but the majority of us were healthy and happy. And now, there wasn't just an assumed risk. It was almost like a prevalent risk of going out. So that fear of infection, suffering, and death for oneself and loved ones, grief after bereavement, financial worries. I mean, all these unprecedented stresses coming at once. And this is why, I hate to say it, one of the fastest growing death rates in the society is actually 15 to 24-year-olds. And you're thinking to yourself, the majority of the time, those are happy, healthy individuals. But 2 of the major 4 reasons are suicides and drug overdose. And I'm sure we all are aware it's not bad people that do drugs. It's often sad people self-medicating. So those 2 things kind of go hand in hand. On top of young people, women were hit the worst. I mean, the maternal instinct, both nurture and nature, to provide for a family and your children and to protect them. And then there's this unknown factor beyond, not to mention getting them to their pediatricians and the missing vaccinations and things that are supposed to be happy, healthy as well. I mean, just an immense stress. And it also severely impacted people with pre-existing health conditions such as asthma, cancer, and heart disease. Imagine not being able to see your doctor because of threat of illness when you're already ill. I mean, I can't imagine how people felt in these instances, but there was an increase in prevalence of mental health problems that coincided with these severe disruptions in the mental health service, leaving gaps for those who need it most. Now, fortunately, urgent care being on the front lines for the general population, we were able to keep our doors open. And often I'm the first time a person's seen a provider since their pediatrician. Now, I call it intermediate care because it's in between pediatrician and PCP. The way I help is, I have an EKG. Melissa, I'm sure you've had many people come in, anxiety, panic. And the first thing I want to do is rule out a physiological cause. And the best tool I have is the EKG to show them, hey, heart looks good, sounds good. These are reassurances. Let's get you the right follow-up. And that's why strong referral partners like Melissa have been my greatest tool in these handoffs, not to mention Dr. Sanders and his practice, because he can have continued follow-up, scheduled follow-up where he can track these issues and talk about things and start medications when warranted. And then another big thing we do besides screening is education. I mean, Cindy, this is the stuff that, I pass off to you: diet, exercise. Just like when you're anxious, it makes your stomach upset. What you put in your body makes your nervous system upset. And let's not forget, I know you're going to talk about sleep hygiene, things like that. I mean, we are rhythmic creatures and we have completely disrupted our rhythm, and it has had a huge effect on a global scale. Now, it's fortunate that there are online resources like ZocDoc and Sesame for those who couldn't get out or who were too frightened to come out, and they could have medications delivered and things like that. But Melissa, you and I agree, it just doesn't necessarily replace the face-to-face interaction and the engagement of the body sometimes. So with that, I'll hand it over to you, Melissa.
Thank you so much. Thank you, Dr. Romeo, for this opportunity, and Dr. Sanders and my fellow colleagues. I just thank you for this opportunity. So maybe a question can be, what is the link between the body and mental health? So the body holds on to the depression, anxiety. It holds on to it without us consciously knowing, hey, my body is holding on to this. But the way we position our bodies, our body holds on to trauma, and trauma is such a spectrum. It's different, right or wrong for people. So I wanted to provide just a little bit of awareness that yes, the mind, the body, the heart, the emotions, they're all connected, and they can all provide some signals as to something maybe a little off. So the statistics that you provided are very real, we're still seeing ramifications, especially like you said, within that age group. So I wanted to provide just a few warning signs of what you can look for, and maybe some language as far as talking to a person that could be struggling. The first, I would say, well-known sign is to take a look at a person who's withdrawing, a person who just, their behavior isn't the same. Maybe they are wanting to isolate a little more. So yes, as you were saying, Dr. Romeo, we've had this period of where we've had to be isolated, and then going down that rabbit hole of what if I do this? What if I contract this? What if I do that? Those, what we call cognitive distortions, aren't always helpful, but they're there. So working with a professional to work through those can be helpful. So when you notice someone withdrawing and isolating, having that conversation of, instead of shame or accusing, but like, whoa, hey, I've noticed something could be going on. I'm wondering what could be helpful. Is there anything I can do? Is there someone I can connect you with? That is vocabulary that may be helpful. Another warning sign is just a person exhibiting an increase of anxiety. Maybe they are forgetful, they are having trouble remembering, they are just having trouble getting to their appointment, staying organized. That can be a symptom of anxiety. So again, instead of that shaming, like, what is wrong with you? But maybe, wow, I noticed that there could be something going on. I'm wondering, I'm curious, what can I do? So that validating language can be helpful. Something that we sometimes don't think about, but can definitely be a red flag and challenging for people are transitions in life. That can be getting married. That could be having a divorce, having a child, adopting a child leaving the home for whatever and becoming an empty nest. And then retirement. So even though retire earlier, I am finding so many individuals really struggling with retirement. This is a time where a person may begin isolating. Their life has changed. Maybe there's a maybe they're feeling like their lack of purpose. Another warning sign is a chronic illness. So with the pandemic, not only were many people isolated from going to their doctor or having to see their doctor via telehealth.
Whoops.
Uh-oh.
I was just checking to see if it was my computer.
I apologize for the connection. Maybe it's the rainy weather. But going back to the chronic illness, during the pandemic, people weren't always able to get that connection with their specialist, with their primary care doctor. But chronic illness can be another indicator of your life is different, it's changing. And so kind of going back to that purpose of with a chronic illness, maybe a person can be feeling like, wow, my purpose has been altered, or I don't have a purpose. So again, instead of shaming that or going, oh, you're fine, don't worry about it, you're wonderful as you are, finding the language of validating and just, wow, this must be incredibly stressful. It's a change. It's an incredible change. And providing that vocabulary of what can I do to help you, not fix the problem, but who do you need to see? What kind of resources do you need? That is language that can be helpful. Some other signs, if you are noticing maybe some unusual bruising, some scratches, some cuts, again, with curiosity and validating, like, I'm noticing what's going on. I'm just wondering if you're okay. Is there something I can do? Is there a resource that you need? But that could be indicative of someone self-harming. All of this to say, to summarize, go with your gut. If you're noticing a change in someone's behavior, someone that you care about, a colleague, a loved one, ask. It doesn't hurt to ask. But I also offer that there's a way to ask instead of that shaming or like, what is wrong with you? Kind of like, whoa, hang on. I notice something is different and I'm concerned. I'm wondering if there's some resources that I can provide for you. So go with your gut. Thank you so much.
Thank you, Melissa. That is so awesome. I think when we could put really good language and ask really good questions, and be non-judgmental. There's so many places we could go with that, and that opens the door. So I took some notes. I love the language you shared with us, and I hope that many other people hear this as well. Before we go on and have me share my part, Dr. Sanders, is there anything you want to add to what's been discussed to point?
No, I mean, I think these are all great, great in terms of kind of painting the picture of where things are. I've definitely seen a huge uptick through the pandemic, and it seems to be persisting. So now more than ever, I think people really need to have great access to people that can help. So primary care is always a great place to start. Counseling is always a great place to start. There should be ample folks available, and just reaching out and trying not to avoid what the concern may be, and not worrying about stigma, even though I know it exists. That's the best way to try and get better and get on the right track. We've seen such an uptick over the past year and a half, 2 years, that we're contemplating adding a psychologist to my practice to help people more from the talk side of things and working through longstanding issues and problems that where a lot of these concerns may stem from, just because it can be such an important aspect of getting people the proper care.
Wow, that'd be wonderful. Absolutely wonderful. Anyway, the world needs more of that. Anyway, thank you. So I'm going to go ahead. Like I said earlier, I am a health coach, so I am not a mental health professional, but what can we do for ourselves that we could be totally responsible for ourselves in doing the best that we can and showing up the best that we can for ourselves every day, and possibly minimizing some of that stress and some of that anxiety that, many of us carry around with us. So, it really goes back to basics. It goes back to, are you sleeping well? Are you feeding your body nutritionally in a way that's going to support a healthy mind? Are you taking out time for yourself and giving yourself self-care? Are you eating properly? So I'm going to go over some of these topics, and if you have anything to add to it, please do. But I'm going to start with sleep. Sleep is foundational. Like if we get a bad night's sleep, I don't know about you, but I'm pretty grumpy. My motivation to do even things that I love to do is down in the dumpster. So really creating good sleep habits. And so many people that suffer from anxiety or depression might have trouble getting to sleep, staying asleep, and what can they do in those times? So really having an hour, twilight hour before you go to bed, and shutting things down, no computers, no phones, no anything, getting quiet, spending time with loved ones, reading a book, meditating, journaling gratitude. Like if you can journal, 3 things that you were grateful for today, it really has a great sense of carrying over into your sleep and into the next day. And also thinking about, okay, this is what today presented. How can I do better tomorrow? In the same light, when you wake up in the morning, if you could have a morning routine that is, you're waking up fresh, there's not a lot of ideas going through your head. So if you could start the day and put yourself on a positive framework where perhaps you're starting with some meditation, and some people might say, I can't meditate. I don't know how to meditate. I'm not good at that. My mind goes monkey. Well, it's like building a muscle on your body. You might not be very good at it first, but give it some time and it will show up. So there's plenty of apps to help you with that. The 2 that I like is Insight Timer and Calm. And the thing that's good about that is you could do that in the morning, but you could also do that during the day. If you're working or you find yourself stressed, you pull that out. There's things, 5-minute meditations that could actually take the color of your day and make it a bit brighter. So really recommend that. The other thing that we know is really good for us, and a lot of times we think of it as being good for our physical bodies, but it's really good for our emotional self too, is exercise. And if we could wake up in the morning and move, even if we move for 5 minutes, it could have a significant impact on our day. So sometimes, if you say, oh my gosh, I just don't have enough time, turn on some music in the morning and start dancing. And you'll be surprised what that does. I actually participate in a work Zoom for an hour a day, and every 20 minutes we get up and dance. And I was pretty resistant about that, but oh my gosh, it really sends some positive energy. It makes you smile, and it really helps you be very creative along the way. So movement, not just in the morning, but movement throughout the day will support feeling better. The other thing is go outside and move, and we are in the perfect season, get that vitamin D3 going. And that is really helpful on our moods. When the sun is shining, we feel really good. We could smile. When we look outside and it's raining and storming, we're like, blah. So really hit the outside as well. One of the things that I absolutely love, we carry it around with us. We do it every nanosecond we're alive, is using our breath. And it is one of the most calming things that we could do is really get into that belly breath and just take it slow. So there is, I don't even know how many ways to do this, but Dr. Weil does a 4-7-8, breathing in for 4, holding for 7, and breathing out for 8. There's the 5 and 5, breathing in for 5, out for 5. Multiple combinations, but basically what you want to do is you want to slow down your breath and breathe right into your belly and breathe out and slow it down. So a couple of tips around that. Obviously breathing in through your nose. A lot of meditations will say breathe out through the mouth. And when you're breathing out through the mouth, if you could pretend that you're breathing into a straw, it actually slows it down. And the other thing that could help is breathing in through your nose and out through your nose. And that in fact slows it down too. So which one is best? The one that you are most comfortable with. So anytime you need it, give it a try and see what its calming effects have. The other strategy that I just truly love is what we call stop, challenge, choose. If you find yourself in a position where you are stressed, you're about to maybe fly off the handle or go and attack the pantry and eat, a couple of bags of potato chips, stop. Your body wants to just react without going to its thinking brain. So I offer my clients, stop, take a drink of water. I can't talk while I have the water in my mouth. So nothing's going to come out of my mouth that I'm going to feel sorry for. Okay. And I'm going to challenge myself. Is that next thing that I think I want to do going to serve me or hurt me? Is it going to serve someone else or is it going to hurt someone else? And then choose what can I do that would be more supportive for myself and for others. Is that going for a walk? Is that listening to music? Is that dancing? Is that meditating? What is that behavior that will put us in a much better position? So that is another technique. And last but not least, nutrition. And so I started with one super important one. I'm ending with one. We think about food as being good for our physical health, but food is obviously important for our mental health as well. And so, you want to eat a variety of foods. So we always talk about eating fruits, vegetables, whole grains, lean proteins. So make sure that you're eating a variety. The 3 top foods that you want to use for your brain health and your mental health are complex carbohydrates, not those sugary snacks that, are, candy and white bread and all those things. You want to have your whole grains, your legumes, your starchy vegetables, such as sweet potatoes, beets, quinoa. And you want to have some lean protein. Lean protein includes chicken, meat, fish, eggs, nuts, seeds, and soybeans. So those are really good choices. And it allows our body to have the energy to think and react quickly. And the third and very crucial component of proper function of your brain and nervous system is fatty acids. And that again, so keep on eating your fish, your meat, your eggs, your nuts, and your flax seeds. Those are super good components of a healthy diet, along with healthy fats like avocado, olive oil, and coconut oil and flaxseed oil. So those are really some good options as well. So, be careful where you eat and when you eat. Sitting in front of a TV, not so good. Great time to sit with family and friends and enjoy the meal and know how much you're consuming and being aware of it and chewing slowly so that, we're just maybe not eating our emotions or just filling ourselves up. So that's what I've got for you today. And I hope that serves. And now's the time when we could ask some questions, contribute if you have something to contribute based on anything that we've all said here today.
So on your recommendation, I actually started before I pick up my phone in the mornings and start my day, do that positive meditation, even if it's thinking about the things I want to get done. And then I kind of just think about the important things in life and things I'm thankful for in general. And I set my alarm about 15 minutes earlier than I really need to get going. And it's actually very much improved that issue I was having, feel like I was just shot out of a cannon. And then Melissa, I really like what you said about go with your gut, but tone and approach. It's always a good time. It's always, what is it? The road to hell is paved with good intentions, right? But if you don't monitor tone and approach in certain situations, you're not likely to get outcomes. People are just human beings trying their best to get through every day. Am I right? Good. Okay, cool.
Cool. Any questions or comments from anyone else? Tina? You're muted.
Just try to unmute myself. There we go. So my big interest in this whole thing is creating awareness. Melissa, you were talking about ways to approach it and handle people that are suffering with mental illnesses or depression, anxiety, whatever it may be. Now, how can we create more awareness so that we understand each other better in these processes throughout life? Does anyone have ideas? I mean, this is always, and it's kind of a mission behind my book that I want to, when I reformat and republish, I want to get more of this information out there. But just, I feel like raising awareness is going to help the situation a lot and help us all accept each other where we are and what level we are.
I think that's a great question. If you don't mind, I'd like to interject. I think one is to help stop that stigma is to, again, it comes back to what you were saying earlier, Dr. Romeo. Instead of things have to be this way or this way, sometimes it just isn't. So having the language to listen, to validate and not fix it and say, you have to do this, you have to do that, but just listening, that can create awareness and like, wow, this person was able to express how I was feeling without someone shaming it, without someone trying to say I was wrong. I think as more people can become tolerant, patient, and listen, I think that will truly help increase awareness. Just my thought.
True. I would like to spread that message more, like on a broadcast media. I feel, because I've studied this a lot in the past few years, and I feel like there's just a lot of people, you kind of get stuck in your own bubble, aware of what's going on with other people outside of you, especially if you're one of those that's maybe suffering with something.
It's funny, Dr. Sanders and I he had me read a book called The Art of Self-Discipline, which basically talks exactly what you're saying is you put yourself in a construct and you forget people are in theirs and you only see them as how they affect yours. And much like you were saying, or reiterate, Melissa, it gets to a point where it doesn't have to be if A or B, it can be C, it can be D, it can be E, it can be F. It's just a sensate reality. I mean, that's how the world works. It doesn't have to fit your schema for it. And that's something I struggle with every day as both a provider and an individual is things will throw me off my rocker because it doesn't fit this construct I've created for my own safety. So.
And what about, if I'm not asking too much or taking anyone's time here, you talk about meditation, and I'm very well aware, as you know, I think you know, Cindy, about the breath and meditation and how powerful it can be. But do any of you have recommendations for people suffering with like ADHD, where their mind just wanders and you have a hard time getting yourself into that state of mind, so to speak, because the mind's always on the go?
I think fidget spinners, I think those are really effective. I'm just kidding.
I think they are effective.
Yeah. Oh, they worked. I just know that people.
I have one right on my finger.
There you
Kids
go.
got one,
Fidget
yeah.
spinner.
One of my favorite meditations and is just a walking meditation. So I think people can get caught up in like, oh, meditation has to look X, Y, or Z. One of my favorites is a walking meditation. I definitely have some ADHD tendencies myself. And so just when I have an opportunity to disconnect from my phone and just be present, meditation is just being aware of your breath and being present. So when I definitely encourage people who struggle with this high level of anxiety, a person struggling can't just stop and meditate. So it's taking that challenge, connecting with the body and going, whoa, let's just come into the present moment. What is it like to just disconnect and take a walk, talk to the animals, whatever, talk to the tree, hug the tree, just being present.
Well, you're saying people aren't supposed to be inside holding their phones all the time. I don't think Apple would agree. I do think Walt Whitman would agree with you, though. I think he has like a whole book of poems on exactly what you're talking about.
So my input on that is, this is a girl who never thought that she could ever meditate, because I didn't think that I could shut my brain down long enough to do so. And like with any habit that we're going to create, you know, if we could start really small, you might only be able to do a 3-minute meditation or a 5-minute meditation. And I think sometimes we don't have a full awareness of what meditation really is, and that you don't have to be perfect at it. And it's, to me, it's like building a muscle. Like, I meditate and there's thoughts that go through my head as I'm meditating. And I hear the people through Inside Timer saying, you know, that's normal. Just let it float by and float out. But just like anything, me meditating for 10 minutes and having some of those interrupting thoughts is better than me not meditating at all, right? And so just the expectation that some days are just going to be better than others. And the sooner that you could get into it, especially in the morning, I think there's less thoughts that float through it. But start really small, build the muscle, and don't have the expectation of perfection.
That's perfect. Yeah, you're right.
Anybody else? Any other questions, comments?
Does anybody have any tips? I want to say for like motivation, but I think one thing that how the pandemic impacted my household and some people I know was getting used to doing nothing. If that makes sense. And I don't want to say getting lazy or having the excuse of the pandemic not to be active or social, and then getting very comfortable in that. And then the side effects being, not, depression, or just not, it's kind of like a snowball effect to where you're like, wow, I haven't seen people, I'm not doing things that I used to do. How do I get back into that, or that purpose, or feel, that just kind of that motivation to do more things? Does anybody have any tips for that and people around you that, again, maybe they're not noticing it, to where it's like, hey, you're watching 4 hours of TV a day now, and before we were doing things, and it's hard to talk about that to somebody, or even for yourself.
Melissa?
Sure, thank you. So I think noticing that it's a struggle is helpful. Instead of, again, I go back to judging what is wrong with me, just noticing, wow, this is a struggle. So our brains love dopamine, our brains love rewards. So when we find that we're not motivated, and I talk about this quite often with patients who are challenged with this very same thing. So I thank you for bringing it up. Start small. Cindy, as you were saying earlier, it's almost like a muscle, and start small. So when you write something down and literally check it off, that's a dopamine increase. And it's your brain saying, whoa, I did this. And even if we can verbalize, like, I went from 4 hours of TV down to 3 hours and 30 minutes. That's an improvement. That's progress. Tell your brain, like, hey, brain, I did this. Again, it's a dopamine increase. Your brain wants that. That's a reward. I think checklists are helpful. And again, just figuring out what works for you, just being creative in that, but recognizing that start small. Your brain wants that reward, and it doesn't happen overnight. That just having all of this motivation isn't going to just happen overnight. Be creative about it. Tell your brain, hey, I just did this. It's a dopamine increase. Any other thoughts?
I do. I to kind of tag on what you're saying there, is writing a list of your accomplishments down every day. I know that works better for me than a to-do list, because a to-do list kind of stresses me out. So I'll write what I accomplished on my to-do list. I know I'm an artist, and music and art is one of the best ways to get there. It doesn't matter if it's a perfect painting or a good one or a bad one, but the sense that it gives you a sense of accomplishment. So there's your reward. Your reward system kicks in then, and that can help change the course, whether it be music, art, dancing, anything in the arts, writing, journaling, all of that.
Eric, I just read a great book called Atomic Habits, and it kind of speaks into some of what you're describing, that, or, you know, that other folks are describing, that it's more about building rewards into healthy habits and trying to I guess, build things into unhealthy habits that make you avoid them. So I'd really encourage reading that book. We all struggle, I think, to some degree with what you're describing. And the more you can be cognizant and build towards things that, you know, are what you desire to do, I think the more you're going to be happy at the end of the day.
Good stuff. I do have a question if everybody's finished that question. Hopefully that helped, Derek.
Yes, thanks.
Cool, cool. So I have a question. I was sharing it with Dr. Romeo before we got on, but is depression a life sentence? Is it, once you have a diagnosis of depression, is that something that is just within you and it's a matter of sometimes it's at a high and sometimes it's at a low? Or is that something that you could work through and no longer own?
I think it differs from one individual to another, but the reality is a lot of staying out of these ruts is being aware, having proper skills to help yourself when you start to feel things becoming more of a difficulty, and then knowing who to reach out to, what the best resources are if things are getting out of your control. But I think it's very individualized, and many people, it is not something they deal with on a recurring basis throughout their life.
Okay, thank you.
I agree. I went through it as a teenager, but mine was situational due to trauma. So that's long gone for me. I agree with Dr. Sanders, I don't have my glasses on, that it does vary from individual to individual, whether it's chronic or temporary situational.
Mm-hmm. Melissa, is there anything you want to add to that?
I again just wanted to say thank you, Dr. Sanders. Yes, it's very individualized, and for some people it can be somewhat cyclical. So just learning, going to a professional, learning this, becoming aware, learning the skills, helpful coping skills is helpful. And that's just such a unique, individualized question.
Cool. Okay, good. Well, anything else? I think we got it. I think this was a fabulous discussion, and I really, truly appreciate everybody's perspective, input, and all that. Thank you for being here. For all of those that are going to listen to this later, thank you for being here too. And we have a lineup for the rest of the summer. We are going in June, and I'm sorry, I did not bring the dates with me. So if anybody has them off the top, in June, we're going to talk about men's health. In July, we're going to talk about summer health. And I believe in August, we're going to talk about, getting back into routines, kids going back to school, immunizations, and things that need to be taken care of as we start a new season of getting back into, fall structure and change and things moving forward. So thank you, everybody. It's been a great time, and hope to see you all next month. Thank you.
Thank you, Cindy.
Meet all of you.
Thank you.
Bye-bye.
Thank you, Cindy. Bye-bye.
Bye-bye.
Thank you.